Hello. Hi, everyone. It's great to see a lot of people coming on here tonight. I know we have a lot of people signed up. We are going to go ahead and get started at 7. So I'm just going to wait a little bit and watch to see some more people come in. I know a lot of people are weighing in here. I know people are interested in learning about inflammation, which we're definitely going to cover tonight. Good amount of information on inflammation. And estrogen hormone imbalance we'll be talking about tonight. So I'm just going to give it like maybe another 30 seconds or so, and I'll go ahead and get started. Let's see what else is in here. Okay, someone is talking about belly bloat. Yep, we'll touch on that a little bit. I think some of you here were on our last webinar, but it's a lot of new faces, a lot of new names here. So I'm excited to get going. So go ahead. I'll go ahead and get started. Hopefully everyone can hear me. Bridget from our office at Whole Health, can you just weigh in? Yep, okay, great. Just wanted to make sure everybody could hear me. So let me introduce myself. I'm Dr. Jennifer Stagg. I am the owner of Whole Health Wellness Center in Avon, Connecticut. I'm a naturopathic doctor. We've been practicing in that clinic since 2006. We've been in practice. We're located just next to the Wellness Center in Avon. We used to be in the Avon Wellness Center for years, and now we're in the next medical building. So any of you local to us, you might know where we are exactly, but we're really close. Let me introduce you to our team. So it's me there and my husband, Dr. Mark Stagg, who is a chiropractor, certified sports physician, and also practices acupuncture. And we have 2 other naturopathic doctors, Dr. Ayla Clark and Dr. Karen Bender. We all accept insurance. So most of the patients that are coming to us, I know that's always a question we get when we do these webinars. We've done quite a few of these now. We do accept most major insurance plans. Occasionally we run into some exclusions, but mostly we accept insurance. And we are integrative in our approach. So a lot of people who come to us end up, seeing us because a lot of times maybe they're a primary care doctor or a specialist to them. So it doesn't mean, if you come to see us, you have to dump all your other care providers. We do work in coordination with all your doctors. So tonight we're going to get really into the meat of the presentation here now. Tonight we're going to talk about some of these major issues that are behind a lot of the common symptoms that we see. So when a new patient presents to our office, some of the most common symptoms that we see, which I bet many of you may be familiar with, I know I've had some of these, fatigue and stress, probably the most common issues we encounter. Weight gain, weight loss resistance. So people who are having difficulty losing weight that didn't have problems before, or maybe, lost 20 pounds and now they've plateaued and they're having trouble losing additional weight. We do see a lot of that. We're able to help a lot of patients with that. And then, of course, changes in body composition and new deposition of belly fat. So like, where things are sort of moving around, a lot of that can be hormonal in nature, and things change as we age and get closer to perimenopausal age, which, over the years, we've seen that onset coming earlier and earlier. So women can start dealing with this in their early 40s, even late 30s for some women. So some of those, in addition to, feeling tired and having problems losing weight, women will also complain of brain fog and irritability and irregular periods and changes in their bleeding. Sleeping problems as well, and then joint pain, muscle aches, changes in hair, skin, and nails. We see a lot of this, and these are common symptoms that we see here. I know, and please, I do want to let you know, please wait if you have some questions throughout the presentation. I'm going to keep an eye on the chat over here and see if I can answer any questions Bridget from our office is also in the chat, so she can answer some questions, technical questions about insurance and routine questions about the practice. But I'll try to address, hopefully be able to address most of the questions you have. If you have something that's really specific related to, a personal health issue, I can't give you personal advice, but I can, really touch on some of these questions that are coming in here, concerns that people have. So let's go into, what the major causes that we see, what we look at when we're looking at patient that comes in with some of these symptoms. So we're really going to cover a lot of this tonight. So inflammation is a big, big underlying cause of a lot of these symptoms that we see here, but also what causes inflammation I'm going to talk about tonight, and also what the outcomes or health effects can be from people who are encountering chronic, unresolved inflammation. I'm also going to talk about stress and how that affects our genes and our hormones. I'm going to really do a bit of a deep dive on estrogen imbalance. A lot of slides I have included here about estrogen because I get a lot of questions about estrogen imbalance, and maybe you've heard some of the terms estrogen dominance and estrogen overactivity. We'll talk about that, and then I'll touch on the relationship of cortisol and thyroid function, and then cover a little bit related to lab testing. And then I'm going to also let you know how you can book a free call with our clinic. So certainly if you just wanted to start and make an appointment, you can call our office and make an appointment, but you can also do what we call a discovery call, where you can speak with one of our staff members and they can help guide you, listen to some of your concerns, and let you know whether they think we could help you in our office. So let's talk about inflammation first. So inflammation is a necessary process in the body. Inflammation, the kind of cardinal signs of inflammation, if you were to injure yourself, for example, so say you twisted your ankle, some of the symptoms that can start, obviously you could have pain right away, and then the swelling can start to set in, the area can turn red, it can be warm, you could, it could be so severe as a loss of function. And all of this is necessary for your immune system to heal that injury. Obviously sometimes we need surgeries and we need casting to help reset, if there was fracture or something. But this is your body's natural process to heal any sort of injury. Same sort of situation if you cut yourself, a small cut, we can, our bodies have the ability to heal that. When we don't, when we don't need acute, that like injury healing, that's where we see more issues with what we call chronic inflammation. So this is where your body is having an issue with like turning off the inflammatory process. So it becomes a chronic issue. And the reason why this can be something that becomes chronic and low grade as opposed to acute inflammation that's necessary from a variety of different reasons. And so we see a lot of these issues with our, modern society. So people who are exposed to a lot of chemicals, in our environment, so in what we call environmental pollutants. Also, just the fact that over time, our population has become more and more overweight, and so there's higher rates of obesity and what we call visceral fat, so that belly fat in the, that you carry in your midsection is a promoter of inflammation. So one of the things that we address, and this can be quite difficult because once you have weight gain, the inflammation can make it more difficult to lose that weight. But there are ways around that. We can address that through really personalized nutrition and dietary strategies. But that visceral fat that sits in your midsection is probably one of the most common causes of chronic inflammation. We also see issues with gut health, people who have irritable bowel syndrome, problems with imbalances in the gut bacteria can be a cause of chronic inflammation. We can see issues with food sensitivities and chronic even infections in the gut. stress, of course, another big driver of inflammation, elevated levels of cortisol, which we'll talk about a little bit later here. Elevated levels of cortisol will definitely result in inflammation. There's a direct pathway there. Nutrient deficits, so vitamins, minerals, some phytonutrient deficits can cause inflammation, but also too many nutrients, and that would be more sort of like caloric excess, can cause inflammation. And then, of course, probably, cardiovascular disease, genetics, autoimmunity can be causes of inflammation. Let's see. So I'm going to just address a couple of questions I see coming in here about blood work. Yes, we definitely do blood work. I'll touch on that. We use a lot of different blood testing. We use advanced functional lab testing, but a lot of what we do is really run through local labs request, and so a lot of it is covered by your insurance. We are not MDs, we are naturopathic doctors. There's a question there about if we're medical doctors or traditional doctors. And then someone else is asking if we prescribe natural hormones. No. So in the state of Connecticut, naturopathic physicians can't prescribe hormones. So we don't do that. But certainly if we think that somebody needs compounded hormones, we do have referrals to other providers to help with that aspect of it. We do manage hormones from a naturopathic integrative strategy. So we use a lot of personalized nutrition and then specific strategies, which I'll get into a little bit here as we move forward. All right, so what are some of those outcomes that we can see with chronic inflammation? Obviously, some of the stuff that you would expect causing to be caused by chronic inflammation: cardiovascular disease, inflammatory disorders like irritable bowel syndrome, but also conditions like psoriasis, COPD, lung issues, diabetic complications, issues with blood sugar metabolism, what we call metabolic disorders like fatty liver disease, heart disease, type 2 diabetes, metabolic syndrome. Also chronic pain disorders. No surprise to see osteo and rheumatoid arthritis as outcomes of chronic inflammation, but also things like fibromyalgia and degenerative joint disease. Maybe as a surprise to some of you would be mental health disorders and neurologic disorders. So we're seeing a lot of papers over the last few years coming out looking at depression as having an inflammatory component, and also looking at various causes of dementia and neurological disorders like Alzheimer's and Parkinson's having an inflammatory component. I don't think I listed on here, but osteoporosis is another condition that has sort of been recategorized as an inflammatory condition, not just thought to be, just a vitamin deficiency, vitamin D or calcium deficiency. Now we know there's a significant inflammatory component to that as well. So then there comes a term called inflammaging. I don't know if any of you have come across this term, but a lot of papers you'll see coming out with the tagline of inflammaging. But essentially inflammaging is aging characterized by an imbalance between inflammatory and anti-inflammatory responses. So inflammaging is essentially chronic inflammation that is aggravating or promoting the aging process. And so it's thought to be that chronic inflammation is probably one of the major determinants of how fast we age. So beyond the medical conditions, then we also have this other aspect of advanced aging or premature aging as a result of chronic inflammation in the body. So what are some of these main factors that influence aging? There's two categories, basically. One is genetics. So some people will age faster as a result of their family history, this inherited sort of profile. But then there's also epigenetics. This is the impact, what we call how your lifestyle or environment affects how your genes get expressed. And so this is something that is good news because we can influence that aging process through our lifestyle choices. So we'll talk about a little bit of some of these here now: physical activity, dietary habits, stress, And then also the amount of chemicals you're exposed to in your environment will affect how quickly you age. And these also have this impact tightly wound up with inflammation. So when it comes to physical activity, we know that lack of exercise is definitely an identified risk factor for accelerated aging. Exercise, we know, can actually affect our genes. So we can turn on and off genes based on exercise status, which is really quite fascinating. So when you're out exercising, it's not all just about, burning calories. It has this impact on how our genes get expressed. And that's really important when it comes to risk of various chronic illnesses, all those, top conditions that are rated the #1 leading causes of death and morbidity. We do know that exercise, there's sort of kind of like this magic number of 150 minutes a week that's associated with reduced risk of death. And that can, be from a variety of different types of activity, but you really want to be getting about 150 minutes in a week to get this impact from exercise on gene expression. The other thing we think about with physical activity is the effect that it has on your muscle mass. So you want to maintain that muscle mass as much as possible to avoid this condition called sarcopenia, which means essentially just loss of muscle mass, because that loss of muscle mass will cause decreased decreased mobility, actually increased inflammation. That says decreased inflammation, but it should be increased. Also increased risk of infection with muscle loss, relation to mood disorders, cognitive decline, lower muscle mass, also increased incidence of falls, which would lead to fractures like a hip fracture, and then of course more surgeries. One other big impact on aging is nutrition, obviously. So here's kind of the revised food pyramid. We used to look at this food pyramid, the old school one, and the bottom was all green. So it looked all brown on the bottom. And now it's been revised quite a bit to put all those vegetables on the bottom. So all these great phytonutrients on the bottom, lean sources of protein, healthy oils, fruits, and beans, and some, cheese at the top there. So, as you head up there, those in moderation. And we know that the real food pyramid really is linked to lowering the risk of inflammation and also reducing that rapid aging process. Here is kind of a rude awakening, I would say, when I looked at this graph initially. So this is back a scientific report published in 2015, the Dietary Guidelines Advisory Committee. And what was determined here was looking at the amount of vegetable deficiency in the US. So this is how many percentage of people in various age groups, male versus female, either meeting recommendations, above the recommendation, or below. So the green bar graphs show what percentage is below the recommendation. So this is quite alarming when we look at kids, upwards of 80% of kids not meeting these basic vegetable guidelines. As you get older, what's interesting to see here is that 51 to 70 age group is the group that's starting to meet recommendations at a higher rate, and some of them getting above recommendation. But this slide is very, very alarming and doesn't, I guess, come as a surprise because of the amount of inflammation and chronic disease that we do see in the US now. But it does show how important it is to, get that daily vegetable intake up. Now, other factors I mentioned that can increase inflammation and aging are physical stress, chemical stress. I had mentioned environmental pollutants, but also now emotional stress, a really, really important cause of aging and inflammation. Early life stress does change the way our genes function. So we know stress, like current stress, has an effect on our body, but also even stress that you experienced earlier in life can impact the way your genes function. Now, for some people, based on their genetics, they have more resilience, what we call these resilience genes, that even though they were exposed to significant stress in childhood, that they are, somewhat immune to those effects. But those effects even, can be affecting you later in life. But we do know that some of these changes can be addressed through proper nutrition and some of the other guidelines we're talking about here. So when we think about stress, there's a whole biochemical pathway, hormonal pathway that occurs starting out in the brain and the hypothalamus. And so when you're experiencing stress, whether it's physical, but mostly what we see is emotional stress, that allows or triggers your hypothalamus, which is an area in the base of the brain, to release a hormone that communicates with the pituitary gland, which sits even lower at the base of the skull, and releases another hormone called ACTH that then goes to the adrenal glands, and ultimately we release cortisol. Cortisol, you may have heard of as a potential cause of belly fat. That's a lot of what you'll see about cortisol and belly fat. And that definitely is important when I have patients that are coming in and they are complaining of increased deposition of belly fat, changes in body composition. Then we will definitely test cortisol levels. So that's one of those blood tests that we can do. Check a morning cortisol, we can check an evening cortisol. Sometimes we do advanced cortisol testing, where we're doing salivary testing and looking at the pattern throughout the day to see if we're seeing some disturbances in cortisol that could be impacting things like energy and sleep and mood, but also, belly fat too, which ultimately then that concern is inflammation. So those are important to check out when we're doing comprehensive blood work. So typically when a patient comes in, we're doing a really solid medical history, getting a really good understanding of everything that's going on and all your body systems and, your health history, previous treatments, all of that. But then, with that, we're looking at lab work that you may have had done recently in the past couple of years, and then deciding what tests would be really important to do and personalizing that. So not everybody gets the exact same protocol. Naturopathic physicians are very, believe it's very important to make sure that we're personalizing our treatment plans and making sure that it is individualized. So let's talk more about some of these hormones. I'm going to talk a lot about estrogen. I did just mention cortisol. I'll talk about that a little bit again, and discuss thyroid too. We did a whole webinar on thyroid. I don't know if any of you happened to catch that last week. We are going to do another webinar on inflammation next Monday night, same time. So keep an eye out to sign up for that one. And let's get into estrogen here now. So I have quite a bit of information here on estrogen. It's a little bit heavy, but I'm going to try to keep it pretty concise and really explain it thoroughly. So when we think about estrogen, a lot of times we just think about estrogen as being like too much estrogen or not enough estrogen. And yes, like either way, symptoms can occur and risk of illness and disease can go up. Now, there are some other factors that we need to look at. So first of all, obviously production. So too much or too little. So that is a valid concern. But a lot of what you don't hear much about is how estrogen gets processed in your body. So estrogen metabolism. Also important is which tissues are being bound, which receptors in the tissues are binding estrogen, and then whether the estrogen metabolites are getting excreted or eliminated properly through urine and stool. All of those are really important when we think about estrogen balance or imbalance. So we're not going to go over all these details in here, but I just put this slide in here to show you just kind of a little bit of an overview how complex it is, but let me break it down a little bit better for you. So hormone production, estrogen is produced from ultimately from cholesterol. So there's a cascade of hormones that go through. So, you hear about cholesterol, and mostly we hear about it because of elevated cholesterol and risk of high LDL cholesterol causing atherosclerosis or plaque deposition and increasing the risk of heart attack and stroke. But cholesterol also has a purpose, just like inflammation has a purpose. And cholesterol is a steroid, basically kind of a molecule that gets converted to pregnenolone and then to progesterone, and some of that gets converted to cortisol. Pregnenolone also gets converted to DHEA, androstenedione, and then to testosterone. And then testosterone is converted to estrogen through a hormone called aromatase. Now, a lot of different hormones, we can test all of these hormones. You can do some of this testing through blood work. So you can do, Quest Lab and test many of these hormones. But to start looking at metabolites, which I'll talk about here on the next slide, that does require more what we call functional testing. And that means you're doing typically a urine or saliva-based test. We use urine testing. We use Dutch testing. Seems to be the gold standard and most reliable form of testing that we use. And that helps us get a really detailed picture of what is going on with hormones. So what a lot of times people don't realize is that estrogen production can be influenced by your lifestyle and diet. So it's not just, you hit a certain age and these problems kick in. Your diet, your lifestyle, your body weight, what's happening metabolically. So whether, you have a diagnosis of metabolic syndrome or high insulin levels. Insulin, again, is another hormone that we can test that increases belly fat. That's also going to decrease something called sex hormone binding globulin. That hormone carrier protein can be tested, so we can also test that. But what happens here when you have problems with blood sugar regulation and high insulin levels is that you end up with more free estrogen that can circulate in the bloodstream. That's going to potentially result in more belly fat is the problem with that. So this higher levels of aromatase will allow the conversion of testosterone to estrogen. Now as women, we need some of that testosterone there reserved to help with maintaining lean muscle mass. So this becomes a problem here. And these are factors that we can address through personalized nutrition to help kind of, move these pathways in the right direction so you're not shunting your testosterone into estrogen. So that's sort of the first phase when it comes to production. Then the next step is metabolism. So sometimes people are having issues. So it could be a production issue where some of the symptoms like belly fat or problems with, perimenopausal symptoms can be coming from what we call estrogen dominance because of the actual hormone levels. Now, another factor that we consider are these estrogen dominance symptoms coming as a result of estrogen metabolites. This means how those forms of estrogen get converted and what we call basically detoxified. This is happening in the liver. So our liver detoxifies not only the chemicals that we're exposed to in our environment, and it, processes medications we take, it processes caffeine, it also processes the hormones we produce in our body. So estradiol, which is our most powerful form of estrogen, and estrone, which is E1, can be metabolized through these pathways. Now we want most of it going through a pathway called 2-hydroxy. And this is a desirable pathway. When we do that functional estrogen hormone testing that I was mentioning, we can look at these metabolites. So we can actually see the proportions that are happening. You're never going to, you want a balance of these. You're not going to have the absence of the bad or, ugly forms of estrogen metabolites, but you do want to see a balance between those. So you'd want to see much higher levels of the 2-hydroxy, the one in the green. Then you'll see 16-hydroxy and 4-hydroxy. And this is how we can determine, okay, well, what's happening with these metabolites? Do you have more of these bad metabolites that, actually increase your risk of hormone-sensitive cancers? So if you have a family history of breast cancer, there are some concerns of hormone-sensitive cancers. This is also important testing to do to see how your metabolites look at risk. And there are supplement strategies that we can use to move these pathways in the direction and lower the level of these metabolites, which also results in less of those estrogen dominance or hormonal, perimenopausal symptoms. When when it goes through those pathways, then that was what we call phase 1. Then the next phase is phase 2. So we're still on this metabolism pathway. These hormone metabolites then have to get methylated or reduced. So these are all kind of chemical, technical terms. These processes, again, are happening in the liver. So the conversion, these different phases are happening in the liver. So your overall liver health is important here. So sometimes we will do actual targeted detoxification programs, but there are also supportive medical foods that we use for estrogen detoxification. The other kind of buzzword maybe you've heard before is methylation, and methylation is important in reducing some of these negative or bad estrogen metabolites. What we need for methylation are, really specific nutrients, and sometimes those are deficient based on our diet, our soils certainly are depleted, but sometimes just not having as healthy a diet, not being able to get enough of those nutrients can make a difference with what happens with these end metabolites. Some of the supplements that we use to drive these metabolic pathways in phase 1 are things like indole 3-carbinol and DIM, which is extracted from the stems of broccoli. So I always tell my patients that, make sure you're eating the stems of your broccoli and not just the florets at the top, that the stems have really important health benefits when it comes to estrogen detoxification. This methylation I was mentioning, some of those specific micronutrients required for methylation to process the estrogen are things like magnesium, 5-methylfolate, so this is a specific form of folate, vitamin B6, vitamin B12. Many of these nutrients can be depleted in many people. We can test for some of these. So again, when we're looking at lab testing, a lot of times we're testing for nutrients that can be involved as well. There are, really, nice formulas that some of the nutraceutical companies have put together with all these metabolites all together that help with estrogen metabolism. So then the receptors I mentioned. So we talked about estrogen production, estrogen metabolism. I hope I haven't lost too many of you yet. We're getting through this heavy technical information, but what I want you to know are the takeaway is that there are lifestyle and nutrition strategies that can help to process hormones. And it doesn't all mean I've got to take hormones. That's not necessarily the answer. And for some people, taking hormones could be detrimental and could increase the risk of hormone sensitive cancers if you have that in your family. And certainly, sometimes we see more cancer in patients who don't have a family history. So we never know when genes are going to get, excited and turned on. So this brings me to these estrogen receptors. We have 2 main estrogen receptors in the body, and those receptors are the alpha receptors and the beta receptors. So we think about the alpha receptor as being excitatory, and then we think about the beta receptor as being more calming. So the beta receptor is really like the preferred receptor, and it's these healthy forms of the metabolites that bind the beta receptor. So this is why all those metabolites are important, because we want to see more of those in the system. And oh, I'm glad I've got someone weighing in here saying that they're excited about what I'm talking about. So I'm glad to hear that. It's so hard in webinars, let me just say, to know if anybody is like understanding what you're saying, because there's no, back and forth, and as opposed to when we do presentations in person. So, back to the receptors, we want the beta receptors are preferential. And so if we're pushing those metabolites in those right pathways, in those desirable pathways, then there's going to be more binding of the beta receptors. The other thing I do want to bring up is the fact that we have these estrogens that we produce in our body, but we also have what we call exogenous estrogens, what we call xenoestrogens, and those come from outside, that you'll hear about products that influence our hormones. So especially with personal care products, lotions, makeup, you'll see things about parabens and other cosmetic ingredients that can affect our hormones. This is where this comes into effect here. Because the alpha receptors of estrogen can be bound by things like BPA. I bet a lot of you have heard about BPA and other plastic byproducts. Water contaminants can bind to these alpha receptors and cause more trouble for your system, and result in some of these hormonal symptoms that a lot of people are experiencing perimenopause and menopausal. So some of the things we think about then environmentally, checking your cosmetics for these ingredients, even in your food as well. So hormones used in conventional farming can impact these receptors, and certainly some medications can as well. So all things to think about. And this is the naturopathic way of thinking, in that we look at things from a broader perspective, not just like, what's your estrogen level? Here, take this estrogen, or let's give you progesterone to balance out your estrogen. We are looking at this from a full spectrum. So a lot of complexity involved, but this is what we do. We understand it all, but I do feel it's really important for people to be educated that there's much more to the picture than just what's your estrogen level, what's your progesterone level. Now, finally, we have the elimination of estrogens. So that's kind of like the fourth step. The last step is, are you clearing out those estrogen metabolites? And we want to see that going out through mostly what we see as gut elimination. So making sure patients are dealing with, constipation, making sure that's being resolved. Dietary fiber is helpful here because it can help bind up some of these metabolites. There are certain strains of probiotics. The L-acidophilus NCFM strain can help with a enzyme called beta glucuronidase. Something else, calcium D-glucarate, can help with that as well. This enzyme just kind of like packages up estrogen to be cleared. So we, really think gut health then is quite important too. So it's kind of funny, sometimes people are coming into us about menopause, and we start talking to them about, like, are you going to the bathroom? Are you having bloating? All of this is tied together. So we're looking at all levels of the estrogen pathway there. So we made it through estrogen. I hope a lot of you are still with me. We're going to touch on thyroid and adrenal, and then we're going to clue up. I'm so happy that you've hung around and decided to spend your time with me this evening. So thyroid, I did a present on thyroid last week, but I do, every cell in the body has a thyroid receptor. Your thyroid is really important for how you feel. Many of the signs and symptoms of having low thyroid function kind of overlap with symptoms that you would feel from having chronic stress, and also from estrogen. So then, we want to do complete thyroid testing too, to make sure we're having a good understanding of what the hormone activity is in the body, so we know what we need to address. Are we addressing estrogen? Are we addressing thyroid? Are we addressing adrenals? And for a lot of women, we're addressing all of those. But certainly, you know, a lot of women, we can check their thyroid and do the advanced testing with the thyroid and not find anything. But let me go over some of the signs and symptoms of having hypothyroidism, so low thyroid. So you can see this fatigue, weight gain, trouble losing weight, dry skin, increased hair loss, sort of muscle weakness. We'll have patients complain of not being able to open a jar or something, or their coffee cup is heavy, constipation. So again, like if you're having untreated hypothyroid and you're constipated as a result of that, that could affect your estrogen clearance. So you can see how all of this gets intertwined, and you can't just say, like, you know, this is just one thing, like we'll just check your estrogen if that's fine. You know, it could be that you're having low thyroid function. Then changes, you know, with body temperature, having a lower body temperature, cold extremities, brain fog, mild depression even. So many of these symptoms can be, you know, from other things, but it could be thyroid. We're going to talk a little bit about lab testing. I know there's some questions here about labs and Hashimoto's. I'm going to talk about that here in a second. So Hashimoto's is kind of interesting. Oh, I think I skipped a slide. Okay, no, okay. So TSH, we'll talk about that here now. So this is the main test that typically gets run to check your thyroid. So if you're having your annual physical or you're asking your doctor to check your thyroid, you're going to get a TSH test. Now, the range for TSH, it can be really wide. It can be from 0.3 to 5.7. Some labs use a lower cutoff. The naturopathic approach is a tighter lab range. So if it's over 2.5, it is functionally low function. And we're also looking at T4 and T3. So we use a tighter cutoff range that we're looking for functional lab ranges as opposed to waiting for it to get really high. And there are other strategies when you're, you know, in this, trying to get in a tighter zone here, that we think about. We think about adrenal function, which is really tightly tied to thyroid. So we would address adrenal function. A lot of times you can see the thyroid come in line if you're treating adrenals, but sometimes we need to specifically address the thyroid, check for nutrient deficiencies, check for autoimmune disease. So I know someone mentioned hypothyroid. 90% of, mentioned Hashimoto's. 90% of hypothyroid cases have this autoimmune component called Hashimoto's. So we can do the TSH, T4, and T3. Those could all be normal, but if you haven't had your antibodies checked, you could have an issue with your thyroid. And then nutrient deficiencies could be another problem with thyroid. So checking things like iodine, checking iron, those are all tests that we do. I know there was a comment here about Hashimoto's and not being able to keep weight on. So it's interesting with Hashimoto's that sometimes it can kind of like fluctuate around. You could get hyper, and that can cause problems with difficulty with weight maintenance. And then of course there could be other things going on too, not just Hashimoto's, but Hashimoto's in some people can fluctuate around, and so you can have issues with that. Okay, and then cortisol I wanted to get to. So cortisol is this, a lot of times what's talked about is your stress hormone. Your adrenal glands are your stress glands. They sit below your kidneys. They're producing cortisol. Your adrenal glands are also producing epinephrine, norepinephrine, or what we call adrenaline, or and some other other things come from the adrenal glands. But primarily we're thinking about cortisol here, how it plays a role in the relationship to the thyroid. So if your cortisol is elevated, cortisol can lower your TSH, resulting in a decrease in thyroid hormones. And it can block, so that would mean like lower the actual secretion of TSH. which is upstream of that. It can also block the thyroid hormones at the receptor sites, and so you could see hypothyroid resulting from that. And then it can also lower the conversion of T4 to T3, which is your active thyroid hormone. So, anyone want to weigh in here? Has your doctor ever told you that your lab work is normal when you feel terrible? So you probably know my answer to this, that it's you have to do the right tests, right? So a lot of times you might not have had all the testing done. So we will do more testing typically. That's the answer. And we also have access to some of these more advanced testing panels. So more what we call functional lab testing. So those lab ranges don't always tell the whole story. So sometimes the lab range that's listed on your lab work is not entirely accurate, and it might be behind the times, really, and it has not caught up with or been updated with even what like the American Society of Endocrinologists would show. So like for TSH, for example, the American Society of Endocrinologists have 3.0 as their cutoff on TSH, but you don't find that on any lab test. So it's not going to get flagged as abnormal if it's 3.5, but it actually is hypo at that range. The other thing is that bell curves are used. So that's for like 95% of the population. These levels are okay, but for 5% of the population, maybe that level is not a good level for you. So maybe you are hypo and you have all the signs and symptoms. So that's what we call subclinical hypothyroid. And then, as I mentioned, functional lab values are more sensitive and can reveal more issues there. So if we're not finding information through conventional, through the testing that we could do through Quest or LabCorp, then sometimes we will order functional lab tests, and those could be urine tests, they could be saliva, they can be GI profiles, checking for digestive function and checking for issues with the microbiome. And as I mentioned earlier, selecting the right testing is really important. So we don't just run everything, because we do such a thorough medical history and look at what you have had done and, learn a lot about you. We have a better chance of selecting the right types of tests to see what's going on. So our approach is determining the underlying cause and correct those, correct the dysfunction is how we view it. We're not just treating the symptoms, although we are definitely, concerned about symptoms and we want people to feel better, but we do address the cause to help improve the overall health. Ordering the right tests is really important. We also do really personalized lifestyle plans. So we don't feel it, one size fits all. We address the body as a whole. We're looking at all those body systems and how they interact with each other. And then we do really focus on the effects of stress, because 90% of visits to a healthcare provider's office are the result of stress. So that's a big factor when we're working with patients in our practice. And then it's so important to have a good support system as you start to work through all these factors and work on lifestyle changes to help you feel better. Okay, and so I know there's a couple of questions that are coming in about insurance, and I'll talk about that here in a second. Some of the functional tests. So the functional tests, a lot of times there are some out-of-pocket costs with it. They're not astronomical for some of them. Some of them are reasonable in the $100 to $200 range. Some of them get a little bit more pricey, up to $400. Some, depending on the testing that we're using, your insurance might pick up a portion of it, but there are reasonable tests, and it doesn't mean that we're ordering everything all together. There are a lot of different tests that can be ordered, and we really work with people to try to find the right most important tests to run first that seem like we would find what we're looking for. So we do accept insurance. I know there's some questions here. But, you can call in the office, you can, request an appointment through our website. we can allow, like, we are offering a free call with one of our team members. So as soon as I finish the presentation here after the next slide, there's going to be a link pop up where you could schedule one of these free calls. And so it's just a quick 10-15-minute call with one of our staff members, and they'll go through, you know, what you're experiencing, how they think our doctor can help, our support team can help, and plan a, you know, action for your first appointment. Our first appointment, that initial consultation with the doctor, would be either in person or virtual. So our office is in Avon, Connecticut, but we do offer telehealth visits, and, you know, all the major insurance plans are still covering telehealth. I believe that's going to go on probably indefinitely, but it is, you know, I think the governor has approved it through 2023, I think. We do accept most insurances, and that first appointment is a 1-hour visit, as I mentioned. So I thank you so much for joining me tonight. If you want to book that discovery call, you can go ahead and click the link I'm going to pop up here. And thanks for spending your evening with me, and keep an eye out for additional presentations. Thanks so much.